Hernias are more common than you might think. Millions of people around the world experience them. A hernia occurs when an internal part of your body pushes through a weak spot in the muscle or tissue wall that holds it in place. Imagine a bulge pushing through a weak spot in a tire. That's a simple way to picture it. This bulge is often painless, but it can be uncomfortable and even lead to complications if left untreated. Hernias can happen in different areas of the body, but are most common in the abdomen. The most common type of hernia is an inguinal hernia, which occurs in the groin area. Other common types include umbilical hernias, near the belly button, and hiatal hernias in the diaphragm. Understanding hernias is crucial for early detection and seeking prompt medical attention when needed. Let's break down the different types of hernias you should know about. Hernias occur when an organ or tissue pushes through a weak spot in the surrounding muscle or connective tissue. They can happen in various parts of the body and can affect people of all ages and genders. Inguinal hernias. These are the most common type, occurring in the groin area where the abdomen meets the thigh. Men are particularly susceptible to this type of hernia. This type of hernia can cause pain and discomfort, especially when bending over, lifting heavy objects, or coughing. If left untreated, it can lead to complications such as strangulation, where the blood supply to the herniated tissue is cut off. Femoral hernias. Also located in the groin, femoral hernias are more common in women. They happen when tissue protrudes through a weak spot in the femoral canal, which houses blood vessels and nerves. These hernias can be particularly dangerous because they are often small and can go unnoticed until they cause severe pain or complications. Umbilical hernias. As the name suggests, these hernias appear around the belly button. They are common in infants, but can also occur in adults, especially those who are obese or have had multiple pregnancies. In infants, umbilical hernias often close on their own by the age of 1 or 2, but in adults, they may require surgical intervention to prevent complications, hiatal hernias. This type is different from the others as it occurs within the body. It happens when a portion of the stomach pushes up through an opening in the diaphragm, the muscle separating the chest from the abdomen. Hiatal hernias can cause symptoms like heartburn, acid reflux, and difficulty swallowing. They are often managed with lifestyle changes and medications, but severe cases may require surgery. Incisional hernias. These hernias can develop after abdominal surgery. A weakness in the abdominal wall created by the incision allows tissue to bulge through. They can be particularly challenging to treat and may require additional surgery to repair. Proper post-operative care and avoiding heavy lifting can help reduce the risk of developing an incisional hernia. Hernias don't just appear out of nowhere. They are often the result of a combination of factors, including muscle weakness. Weak spots in the muscle wall can develop over time, especially as we age. Increased pressure straining during bowel movements, heavy lifting, persistent coughing, and even pregnancy can put pressure on the abdominal wall, increasing the risk of a hernia. Genetics. Some people are genetically predisposed to developing hernias. If close family members have had hernias, your risk might be higher. Lifestyle factors, obesity, smoking, and poor nutrition can all contribute to weakened muscles and increased pressure in the abdomen. Identifying your risk factors is an important step in preventing hernias from developing or worsening. How do you know if you have a hernia? Here are some common signs and symptoms to watch out for. A bulge. This is often the most obvious sign. You might notice a bulge or swelling under the skin, particularly in the groin, belly button, or surgical scar areas. Pain or discomfort. You might feel pain or discomfort, especially when lifting, bending, coughing, or straining. A heavy or dragging sensation. Some people describe a feeling of heaviness or dragging in the area of the hernia. Nausea or vomiting. While less common, hernias can sometimes cause nausea or vomiting, especially if they become incarcerated or strangulated. If you experience any of these symptoms, don't ignore them. See your doctor for a proper diagnosis. Section 5. Diagnosis. Confirming the suspicion. Diagnosing a hernia usually involves a physical examination by your doctor. During this examination, the doctor will carefully assess the affected area to identify any signs of a hernia. They will visually inspect the area and feel for any bulges or protrusions. This is often done while you are standing, as hernias can be more noticeable in this position. In some cases, they may ask you to cough or strain to make the hernia more prominent. This helps the doctor to better understand the size and severity of the hernia. Your doctor might also order imaging tests to get a clearer picture of the hernia. These tests can include various types of imaging techniques to provide detailed information. Ultrasound. This non-invasive test uses sound waves to create images of the inside of your body, helping visualize the hernia. It is often the first imaging test ordered due to its simplicity and effectiveness. CT scan. A CT scan uses X-rays to create detailed cross-sectional images of the area, providing more information about the hernia's size and location. This test is particularly useful for complex cases. MRI. An MRI uses powerful magnets and radio waves to create detailed images of the body's internal structures, offering a clear view of the hernia. This test is often used when more detailed images are needed. These tests help confirm the diagnosis and guide treatment decisions. By combining physical examination findings with imaging results, doctors can develop a comprehensive treatment plan tailored to your specific condition. Section 6. Treatment options, surgery and beyond. The treatment for a hernia depends on its size, location and severity, as well as your overall health. Your doctor will evaluate these factors to determine the most appropriate course of action for you. In some cases, watchful waiting might be an option, especially if the hernia is small and not causing any symptoms. This approach involves regular checkups to monitor the hernia and ensure it doesn't worsen over time. However, many hernias require surgery to repair the weak spot in the muscle wall and prevent complications. Surgery is often recommended if the hernia is causing pain, discomfort, or other symptoms that affect your daily life. The two main types of hernia surgery are open surgery and laparoscopic surgery. Each method has its own advantages and considerations. Open surgery. This traditional approach involves making an incision near the hernia and surgically repairing the weak spot, using sutures or mesh to strengthen the area. This method is often chosen for larger hernias or when the hernia is in a difficult-to-reach location. Laparoscopic surgery. This minimally invasive technique uses small incisions and a laparoscope, a thin lighted tube with a camera, to repair the hernia. This method is generally preferred for its quicker recovery time and reduced post-operative pain. Laparoscopic surgery generally results in less pain, scarring, and recovery time. Patients often experience a faster return to normal activities compared to open surgery. Your surgeon will discuss the best surgical option for your specific situation. They will consider factors such as the type and size of the hernia, your overall health, and your personal preferences to recommend the most suitable treatment plan. Section 7. Lifestyle modifications and prevention. While not all hernias are preventable, there are steps you can take to reduce your risk and manage existing hernias. Maintain a healthy weight. Losing weight, if you are overweight or obese, can reduce pressure on your abdomen. Eat a high-fiber diet. Eating plenty of fruits, vegetables, and whole grains can prevent constipation, which can strain your abdominal muscles. Asterisk. Lift properly. When lifting heavy objects, bend your knees, not your waist, to avoid putting excessive strain on your abdominal muscles. Asterisk. Quit smoking. Smoking weakens your connective tissues, making you more susceptible to hernias. By making these lifestyle changes, you can significantly reduce your risk of developing hernias or experiencing complications from existing ones. Section 8. Life with a hernia. Living with a hernia doesn't have to control your life. By following your doctor's recommendations, making healthy lifestyle choices, and being aware of potential complications, you can manage your condition effectively. If you experience sudden pain, nausea, vomiting, or if the hernia becomes tender or discolored, seek immediate medical attention. These could be signs of a serious complication called strangulation, which requires emergency surgery. Remember, knowledge is power. Understanding hernias empowers you to take control of your health and make informed decisions about your well-being.